What if I told you a single computer click could steal a Kenyan's entire medical future? This is Kenya News Update today. Coming up, you'll discover how 20 people in 8 hospitals allegedly turned your health insurance into a cash machine, and why this 28 shillings million scandal is just the tip of a multi-billion shilling iceberg. Meet the Social Health Authority, or SHA. It's supposed to be a lifeline, but here's the twist. Prosecutors say a criminal network saw it as a blank check. On Tuesday, March 3, at the Milimani Law Courts, the Office of the Director of Public Prosecutions dropped a bombshell. Arrest warrants were issued for 20 individuals in 8 medical facilities. They failed to show up to answer charges. The DPP, Rensun Ngonga, had already approved a laundry list of accusations: conspiracy to defraud, operating unlicensed health facilities, acquisition and use of proceeds of crime. But that's just the start. The charges get even more technical and sinister: unauthorized access to computer systems, computer fraud, obtaining money by false pretenses, and abuse of office. This wasn't a smash and grab. This was a sophisticated digital heist. Prosecutors laid out the scheme. The suspects allegedly orchestrated a plan to fraudulently register medical facilities. Then they'd submit claims for medical procedures that were never, ever performed. No surgeries, no treatments, just phantom patients and fake bills, all feeding from the public purse. The alleged result? A loss of approximately 28 shillings million. That's 28 million shillings meant for sick Kenyans gone. But here's what nobody's talking about. This case only gained traction after complaints last August. Who complained? Health practitioners and Cabinet Secretary Aden Duale sounded the alarm over the pilferage, the theft of public funds. This 28 shillings million case is a single thread in a much larger, uglier tapestry. Less than a month ago, the Health CS admitted there were losses of billions of shillings linked to health facilities from the SHA insurance. Billions, with a B. Let that sink in. So who are the accused? The court documents name the 8 medical facilities: Coffee Nursing Home, Dimtu Nursing Limited, Mama Nurbil Nursing Home, Kamzihawa Medical Center, Adfeel Kids Care Medical Center Limited, Jula Nursing Home, Danaba Care Hospital Limited, and Aladi Nursing Home. These are places people trust with their lives and their children's lives. And then something shocking happened in a related development. The DPP charged another individual. He pleaded not guilty before Senior Principal Magistrate Teresa Nyangina. His release terms: a bond of 1 shillings million with 2 sureties, or an alternative cash bail of 500,000 shillings. The court heard the alleged offenses happened on diverse dates between January 30 and August 25 last year. The next mention is scheduled for March 12. Authorities are scrambling to bring all the suspects to court. Here's the part that will blow your mind. This is about more than money. It's about trust. When you walk into a clinic, you trust the system. You trust that the insurance you pay for will be there. This alleged fraud shatters that trust completely. It means your premium might be paying for a criminal's luxury car, not for someone's chemotherapy. The implications are terrifying. If the system is this vulnerable, is any Kenyan's health data safe? Are any funds secure? This case exposes a massive loophole, a digital doorway left wide open. The controversy is clear. Some will say this is just strong action against graft. Others will ask why it took so long, and how billions could vanish before anyone noticed. The biggest unanswered question hangs in the air. If 28 shillings million is what they caught, how many billions more slipped through the cracks? We started with a question about a computer click stealing a medical future. Now you know the alleged scheme. So, do you think these arrest warrants are the beginning of real accountability, or just a show for the cameras? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news that hits where you live.